In this video, I'm going to teach you the three main types of medication to treat foot pain caused by plantar fasciitis. But stay until the end of this video because at the end, I'll show you the best treatment that science offers to definitively solve this annoying pain that's bothering you. I'm Dr. Kelvin, a physical therapist, and I've treated numerous patients with plantar fasciitis using the tips in this video. I even treated my own plantar fasciitis, as I've had this annoying problem myself. So stay with me to learn all about it. The plantar fascia is a fibrous tissue that extends from the heel bone to the toes and functions to provide support and shock absorption for your feet. When this structure is overloaded, inflammation occurs, which we call plantar fasciitis, causing intense pain in the sole of the foot near the heel. This pain often intensifies during the first hours of the day, especially in the morning when a person steps on the ground for the first time. Some of the most commonly used medications in the treatment of plantar fasciitis are as follows. First, we have some medications for acute pain, which is the type of pain you feel in the first few weeks when you start experiencing these symptoms. The most commonly used are anti-inflammatories, which help reduce inflammation and pain in the first few days. Some of them are Naproxen, Diclofenac, and Ibuprofen. But be very careful with these medications as they have various side effects, and you shouldn't use them without a doctor's prescription. Another problem with treating plantar fasciitis only with medication is that the medication merely masks the pain, but the problem is still there because you haven't addressed the cause of the pain. You're only treating the pain. Therefore, when the effect of the medication wears off, your pain returns and continues to bother you. If you want to avoid these problems and especially the side effects, there are some herbal remedies that can help you solve this problem without suffering from the side effects of pharmacy medications. The first alternative I often prescribe to my patients is turmeric, also known as curcumin. It's used as a spice, primarily originating in India, but studies have shown that turmeric has anti-inflammatory properties. More than that, some studies have shown that turmeric is even superior to some pharmacy anti-inflammatory medications like the ones I mentioned. One of these studies, for example, compared turmeric with diclofenac, and these studies showed that turmeric, when consumed 3 times a day, has the same effects as diclofenac. However, it is much superior because it doesn't have side effects, so it can be consumed long-term with great safety. Comment below the video if you've used this natural remedy and what benefits you achieved. Additionally, we have vitamin D and omega-3, which are also natural anti-inflammatories. Besides solving numerous problems in your body, supplementing with vitamin D and omega-3 will help in the treatment of your plantar fasciitis. Finally, a topical herbal remedy is arnica itself. It comes in cream or oil form and is also a natural anti-inflammatory that you apply to the skin. It's even good to ask someone, like your husband or wife, to massage your foot using arnica because it helps with 2 problems. It helps relax the foot muscles, and when arnica comes into contact with the plantar fascia, it also has a small anti-inflammatory effect, helping a little. But when you combine all these alternatives I'm showing you here, it all has a significant effect in the long run. I mentioned the first alternative, which is pharmacy medications. I rarely use this in the treatment of plantar fasciitis. The second alternative is herbal remedies, and I usually combine these herbal remedies with this third alternative I'm going to tell you about now, which is physical exercises. Studies show that physical exercises, especially stretching exercises, are the best remedy in the treatment of plantar fasciitis. Remember in the title of this video, I mentioned the best remedy in the treatment of plantar fasciitis? It's not a pill. The best remedy in the treatment of plantar fasciitis is these exercises, and you're going to learn them now. The first exercise you will do in bed before even getting up. I will teach you how to improve the mobility of your foot by treating foot pain and plantar fasciitis. For this, before getting out of bed in the morning, Cross one leg over the other and do this movement here, like you're pressing the car accelerator, for 10 repetitions. The next step is to stretch the plantar fascia by pulling your toes back. Hold this position, performing this stretch for 40 halves. Lastly, you should take a rope or a belt that you have at home and stretch that entire posterior tract that I mentioned to you. You should secure this rope or belt on your feet, bringing your heel towards the ceiling and your big toe towards the tip of your nose. This stretch can be done in 3 sets of 40 seconds for each leg. The video about plantar fasciitis treatment was inspired by these comments you are seeing on the screen. Leave a comment right now on this video about plantar fasciitis, as I read all your comments with great care. Additionally, your comment with your question might become a future video just like this one you're watching, and you have a great chance of appearing here on the channel. Also, leave your thumbs up, subscribe to the channel because all of this helps me continue my work here on the internet. If you have plantar fasciitis, your plantar fascia is stiff and inflamed, so now I will teach you a technique we call myofascial release. Facial refers to the fascia, and we have the plantar fascia. Myofascial release, as the name suggests, helps to release your fascia, making it softer, looser, and improving your pain. For this, you will need 2 things you have at home, a cream and a spoon. Here I took an arnica cream that I have at home, which has analgesic and anti-inflammatory components. I spread this cream over my foot. Doctor, I don't have arnica. If you don't have arnica, you can use any cream you have at home. Now I take this spoon and with both hands, I perform the myofascial release, pushing the spoon from the heel to the toes in the direction of the plantar fascia, thus performing this myofascial release, releasing the plantar fasciitis. Those with plantar fasciitis will feel stiffness, several little bumps along the way. It's normal to feel this pain, and here, I apply a bit more arnica and perform this myofascial release maneuver on the plantar fascia again for 5 minutes. Another very interesting component is performing the myofascial release of the calf as a whole. As I already told you, the calf is also protected by a fascia, and this calf fascia goes up to the Achilles tendon, ending at the plantar fascia under the foot. It's not exactly the same fascia, but the two are interconnected. Therefore, tension in the calf can result in pain in the foot. For this, I take my cream again, apply it to the calf, and slide the spoon down from its origin. Then I slide it over my calf very calmly using this spoon all the way down, also for 5 minutes. Wonderful. I do this on the inside of the calf, the back, and also on the side. This will also greatly help with your plantar fasciitis. A second alternative is to do myofascial release with a small ball. For this, you can take the ball you have at home and now step on it. So you simply let the weight of your body fall onto the ball, counting 5 seconds on the way there. So 1, 2, 3, 4, 5, and another 5 on the way back. So 5, 4, 3, 2, 1. Do this back and forth for 10 to 15 repetitions. The important thing is that you feel your foot becoming more relaxed and the pain from plantar fasciitis decreases with this exercise. After releasing the calf and plantar fascia, it's important to stretch these structures once more, but now standing. For this, stand facing a wall you have at home, positioning one foot in front and the other behind. The front knee should be bent while the back knee should be fully extended. Doing this, you will start to feel your calf stretching, but pay attention to the tips of your toes. They should be pointing forward and not to the sides. Also, you must not lift your heels off the ground. Maintain this position for at least 60 seconds. In this exercise, you are stretching the gastrocnemius muscles. But now I will teach you to stretch a different muscle, the soleus, which is also part of the calf. For this, still without lifting your heels off the ground, you will bend your back knee, now stretching your soleus muscle. Maintain this position also for 60 seconds. Another crucial component in the treatment of plantar fasciitis is applying ice packs. For this, freeze a small bottle with water, and when this water turns to ice, you will take it, sit in a chair or on a sofa, place a towel spread out in front of you with the bottle on top of this towel. Now, with your feet on this bottle, you will make a back and forth motion. Count 5 seconds on the way there. So 1, 2, 3, 4, 5, and now you will return with your foot sliding over the bottle. 5, 4, 3, 2, 1. You will do this back and forth motion for 5 minutes. After that, you will cover this bottle with a layer of towel, and then you will do another 15 minutes of compress, leaving your foot resting on this bottle with the towel. You might be wondering, Doctor, how many times a day should I do this? If you have more time, do it about 3 times a day, up to 5 at most. Don't leave your foot freezing all the time, and each application should be 15 minutes. After these techniques, you will feel lighter so that you can walk without foot pain, improving your plantar fasciitis. If this video helped you, leave your thumbs up, subscribe to the channel, comment below if it helped you. I really enjoy reading the comments with great care. Additionally, there is a crucial factor in the treatment of plantar fasciitis, heel spurs, and foot pain, which is the type of footwear. Perhaps the footwear you are using now is worsening this problem of foot pain. If you want to know which are the worst shoes for plantar fasciitis that you should avoid, and also which are the best shoes you should use, I am leaving all this information in this video for you to watch. Just click here, and I'll see you there.